Every 4 minutes, someone is diagnosed with a blood cancer, like leukemia, lymphoma, or myeloma. But because of stem cell donors like you, there is a cure for these otherwise fatal diseases. This video will help you understand the peripheral blood stem cell donation process.
This is a wonderful process.
He's been matched to help save a life, and real proud of his decision.
This is my second peripheral donation. It's a follow-up booster to somebody who's already received stem cells.
It has a rewarding sense of trying to save a life.
Peripheral blood stem cell harvesting is a non-surgical procedure that collects stem cells directly from a donor's blood. The stem cells are then transferred to patients who have blood diseases.
Right now we are giving the hope for the cure.
Yes,
Hopefully the cure will come.
Dr. Karina Gonzalez is the medical director of the Blood and Marrow Collection Program at the Lombardi Comprehensive Cancer Center at MedStar Georgetown University Hospital. Dr. Gonzalez specializes in hematology and oncology. The Blood and Marrow Collection Program that she oversees is the largest collection program in the country.
We're coming from Lexington, Kentucky.
Charleston, South Carolina.
Where are you coming from?
England,
And what do you know about that person?
that it's a 53-year-old female.
Do you know what condition the patient has?
It's, I think, a pre-stage of leukemia where it's just the cancer in the blood.
And this is what's happening. If we leave it up to this disease, it will develop a leukemia that is very difficult to treat.
Right.
There are 3 steps in the process of donating stem cells from the blood. First, donor evaluation to make sure the donor is healthy enough to donate. Second, stem cell mobilization through a medication called filgrastim to prepare the actual cells for donation. And third, stem cell collection through the apheresis procedure. The entire process begins with donor evaluations.
I just started getting calls from my representative with DKMS. And so she was setting up physicals, having to come down to Washington for blood tests, EKGs, physicals, and stuff like that. And that was 2 weeks ago. And then scheduled me to come back again today to actually donate.
Our goal is to facilitate the process, to medically care for the donor and watch for their safety during the process, and then to prepare the hematopoietic stem cell product for shipment wherever the recipient is. This can be just locally in the country, or it could be internationally.
All right, so Ms. Meekins and Mr. Matthew. Yes. Today you'll be getting an EKG, chest X-ray. I'm gonna draw some lab work, and urine sample. You get your physical exam done and info session. Okay.
Here at the Blood and Marrow Collection Program at MedStar Georgetown University Hospital, we make it a really, really good effort to make sure we're very thorough in our health history assessment and physical examination to make sure that our donors are safe and healthy to be able to donate.
When a donor comes to donate peripheral stem cells, it's a process called apheresis. And there are 2 steps in this process. First is the mobilization of the stem cells that are normally inside the bones in a cozy little place called the bone marrow. It's a spongy area of the bones. We are taking some of the stem cells from the marrow to the blood. We do that with a medication called filgrastim. It's a medication that is given under the skin to the donors for 5 days. Usually we do 2 shots a day for 5 days. Some of you will receive the shots here for 5 days, and some other ones, I think you, maybe Ryan, you will receive it back home. Until day number 5, you will come here and we will do the collection.
Common side effects of filgrastim include bone and muscle pain, headaches, tiredness, a rapid heartbeat, nausea, trouble sleeping, and dizziness.
Most of the donors tend to describe the discomfort associated with filgrastim as having the flu without the respiratory symptoms. So they feel achy, they feel tired. And what were your symptoms?
Mild lower back pain, my right knee, a little bit of joint pain there, and slight pressure in the chest. How's that?
Did you feel the throbbing
Yes.
that sometimes happens?
Yeah, I can hear it. I can feel it in my ears.
Feel it in your ears. Did you remember what I told you? So you didn't panic.
Yeah, I did not panic.
Additionally, there are 2 rare side effects that can be caused by filgrastim that donors should be aware of.
This medication can cause the swelling of the spleen. We had about 3 donors in over 20,000 that had this problem of the swelling of the spleen. What they had, and towards the end of the treatment, usually it happens on day 5, they had pain on the chest wall, pain on the left shoulder that did not go away. Those donors were admitted to the hospital and evaluated. The medication was stopped, and what happened is, without the medication, the spleen size regressed, and that little tear that we couldn't see closed back. They were released with no problems. The other side effect that is important to discuss is the intracranial bleeding that you may have read. That happened to 2 donors in over 20,000, again, very rare. Those 2 donors had a history of head trauma in the past and also had bleeding. So we think that there is a connection there. It was not the medication, it was the fact that we had a prior history. So that's the reason why you will be evaluated every day and assessed. Your discomfort will be assessed every day on these 5 days.
Concerns donors have about filgrastim are: will I be able to have children after taking the filgrastim medication needed for the procedure?
The answer is yes. We haven't seen any problems. This medication doesn't stay in the body for a long time.
Can donating peripheral blood stem cells cause blood diseases?
We have a nice large database, and we can see that the incidence of leukemia, lymphomas, multiple myelomas is not higher in the population of donors than in the general population.
The next step in the stem cell donation process is the actual collection of peripheral blood stem cells. This step takes place at MedStar Georgetown University Hospital in Washington, D.C. Stem cell donors are provided with airfare, hotel, and meals accommodations. Most donors arrive a day or 2 before the stem cell collection procedure and stay in a hotel in close proximity to the hospital.
On day number 5, we will see you at 7 a.m. Again, Keith will go pick you up from the hotel, bring you here.
Keith, nice to meet you. How long have you been on the register?
The stem cell collection process begins with a final filgrastim injection.
We just go nice and slow because it can sting a little bit.
Right. The donors already got the injections. I drew the blood already, so just need to wait till 8 o'clock to get them down for the start of the procedure.
Good morning.
Hello, Rita.
Once the stem cell collection starts, blood is drawn out of one arm as the stem cells are separated and collected. The remaining blood is returned back to the donor through the other arm.
The little bit of blood that stays in the machine that is yours, we are giving it to you.
Yes. Yep.
How was the placement of the IVs?
It was fine. I mean, it's a little uncomfortable, but
It was
I mean, because you can't bend this arm, so I mean, I'm ready to get it out so I can move my arm.
Did we use the same vein for the drawing line as the other time?
Yes, because this my dominant hand has
And
a
that's
larger
the
vein.
larger vein. The room of the apheresis unit tends to be warm, so I always tell them to bring short sleeves and dressed in layers because they will peel them off during the procedure. We put local heat to avoid the vein from collapsing, and also we have nursing personnel continuously by the side of the donor. We have medications as needed. We try to entertain them as much as we can with TV, with internet access. We allow a family member to be with them.
It's also nice having my dad around to be my little servant.
Common side effects of the apheresis procedure include numbness and tingling associated with the use of the blood thinner, pain at the needle site, restlessness due to immobility, and headaches. Most peripheral blood stem cells collection procedures go smoothly, and the donor can return home or to the hotel the same day.
And my arm feels so heavy.
Tell me, how long was your procedure?
Just almost 3 hours. Just shy of that.
Great.
Yeah, not bad at all.
We always say anywhere from 3 to 6 hours, depending on your response. Questions for me?
No?
So now you are gonna go to the hotel and then home tomorrow. During this procedure, we need to infuse a blood thinner in all this piping that you will see. The blood thinner will be circulating in you. So for those 24 hours, we will ask you not to shave, not to floss, and not to lift anything heavier than 5 pounds. When you donated in June, how long did it take you to recover from the side effects?
I was discharged Tuesday or Wednesday. By Saturday, I was perfectly fine.
You just found yourself back to baseline.
I was tired, worn out, like mono, feeling like you were really worn down. Saturday, I woke up, like somebody flipped a switch. You were instantly better.
Better.
Yes.
And from then on,
No problems
no
whatsoever.
problems. That is wonderful. It takes anywhere from 3 to, some people it takes 2 weeks. How long the veins take to heal?
About a week or so.
You continue to have discomfort, right?
Yeah, it's a little pain, some bruising maybe.
So what do we do with the cells after we collect them? Basically what we do is we prepare them to be picked up the same day, to be taken to your recipient, to the transplant center where your recipient is. The idea is to infuse those cells within 24 hours of being collected. They will be taken by a person, a courier.
We're going to Germany today.
Yeah.
That should be all the same for you.
By this time, the stem cell recipient has been prepared to receive the donor's cells.
Will completely empty the bone marrow, making a space for your cells to come. And then your cells will produce your healthy blood in her body. In general, the donor coordinators call you when the recipient needs to start the chemotherapy.
Okay.
Because without your cells, that recipient would not survive. So it's what we call the point of no return. So, and we want to see your commitment. Those cells are very smart. They know where to go. They are infused in a catheter on the chest of the recipient, and they in the bloodstream, and they will find their way to their bone marrow. But once it happens, his body, is a he or a she?
I believe it's a boy.
It's a boy. He will feel the effects of your healthy blood.
I would definitely be excited to meet him, you know, just to figure out what kind of guy.
Doesn't happen. If he decides, if he chooses to, it can happen a year after the transplant. It takes about a year for a person to fully recover from the transplant. Okay, well, thank you so much.
Thank you. I think it's just a really good opportunity for me to do something good out there. There's no cost in potentially saving someone's life, so I wouldn't be able not to do it.
I like volunteering, and it's for a good cause.
On behalf of the transplant recipients and the blood and marrow collection program at MedStar Georgetown University Hospital, we thank you for agreeing to give someone the hope for the cure. This is a precious gift. Thank you.